How far can technology take us in the world of medicine? A question that sparks curiosity and wonder, doesn't it? We are living in an era where technology is advancing at a breakneck speed, continually reshaping how we live, work, and even heal. Now, it's not just about smartphones, smart homes, or smart cities. It's about smart healthcare, and this is where the world of medicine comes into play. The intersection of technology and medicine is not a new concept, but the velocity at which it's currently moving is truly mind-boggling. From artificial intelligence to virtual reality, from robotics to personalized medicine, technology is not just knocking at the door of the healthcare industry, it has already entered and is making itself comfortable. So how is this rapid technological advancement changing the landscape of the medical field? What impact is it having on diagnosis, treatment, and prevention of diseases? Let us delve into some real-world examples of how technology is transforming medicine. Imagine receiving medical consultation without leaving the comfort of your home. This is the reality of telemedicine, an innovative approach that is changing the face of healthcare as we know it. Telemedicine, also known as virtual healthcare, is an application of digital technology that enables patients to consult with their healthcare providers remotely. This not only saves time and resources, but also makes healthcare more accessible and affordable. It's like having a doctor's office at your fingertips. Imagine living in a remote area, miles away from the nearest medical facility. In the past, getting access to healthcare would have been a challenge. But with telemedicine, the world becomes your clinic. Healthcare professionals can now offer their services to patients regardless of their location. All that's needed is a stable internet connection. Let's consider a case study. During the peak of the COVID-19 pandemic, when in-person visits to clinics and hospitals posed a risk of infection, telemedicine emerged as a vital tool. It allowed patients to consult with their doctors from the safety of their homes. This was particularly beneficial for those with chronic conditions who needed regular checkups but were at high risk for severe COVID-19 symptoms. Not only did telemedicine provide these patients with the necessary healthcare, but it also reduced the strain on hospitals dealing with COVID-19 cases. Think about the elderly, who often have mobility issues and find it difficult to travel. Or consider individuals with mental health concerns, who may feel more comfortable discussing their issues in a familiar environment. For them, telemedicine can be a game changer, providing easy access to healthcare without the stress of travel or the anxiety of a clinical environment. But it's not just about convenience. Telemedicine can be a life-saving innovation. In emergency situations where every second counts, telemedicine can facilitate immediate consultation with a specialist, guiding first responders and potentially saving lives. The digital revolution is reshaping the healthcare landscape, and with virtual healthcare, the future of medicine is not only in our hands, but also in our homes. So telemedicine is not just a convenience, but a life-saving innovation. What if a machine could predict your health concerns before they become a problem? An intriguing question, isn't it? Well, we're not talking about a far-flung future here. The reality is that the field of diagnostics is already being transformed by artificial intelligence or AI. AI, with its ability to learn, analyze, and interpret vast amounts of data, is proving to be a game changer in the world of diagnostics. Let's consider radiology, for instance. Interpreting medical images is a complex task that requires years of training and expertise. But even the most experienced radiologists can miss subtle signs of disease. This is where AI comes in. AI algorithms can be trained to recognize patterns in medical imaging that may be indicative of disease, often with a level of accuracy that matches or even surpasses human experts. This isn't just theory, it's happening right now. Take the example of Google's DeepMind Health project. It developed an AI system that can diagnose eye diseases by analyzing retinal scans, matching the performance of world-leading specialists. This is a vital breakthrough, especially when you consider that early detection of eye diseases can prevent up to 98% of severe visual loss. AI isn't just revolutionizing radiology, but it's also making waves in pathology. Traditional methods of diagnosing diseases can be time-consuming and subjective, but AI can analyze microscopic images of tissue samples, detect abnormalities, and even predict patient outcomes, all in a fraction of the time it takes a human pathologist. Artificial intelligence is also assisting doctors in predicting disease progression and planning treatment strategies. For instance, AI algorithms can analyze genetic data to predict how a patient's disease might progress, helping doctors to tailor treatments accordingly. AI is changing the face of diagnostics, enabling early intervention and potentially saving lives. As we continue to refine these technologies, we are moving towards a future where disease can be detected and treated even before symptoms occur. Now, isn't that a future to look forward to? What if a robot could perform your surgery with more precision than a human? This might sound like a plot straight out of a science fiction novel, but it's actually a reality in today's world of medicine. Robotic surgery is not about replacing doctors with machines. Instead, it's about augmenting a surgeon's capabilities, allowing them to perform complex procedures with more precision, flexibility, and control than is possible with conventional techniques. Let's take a look at an example. In the world of urology, the Da Vinci surgical system, a robot-assisted surgical system, is making waves. Its high-definition 3D vision system and tiny wristed instruments that bend and rotate far greater than the human hand allow surgeons to operate with enhanced vision, precision, and control. One patient, let's call him John, was diagnosed with prostate cancer and was a suitable candidate for a robotic-assisted prostatectomy. Traditional surgery would have required a large incision, resulting in a lengthy and painful recovery. But with the Da Vinci system, John's surgery was minimally invasive. The surgeon used the robotic system to make several small incisions to remove the prostate. The result? John was walking the day after his surgery and was discharged from the hospital in less than 48 hours. His recovery was quicker, and the surgical scars were smaller than if he had undergone traditional surgery. Robotic surgery isn't limited to urology. It's also used in gynecology, cardiothoracic surgery, and general surgery, among others. The benefits are consistent across the board: less blood loss, fewer complications, shorter hospital stays, quicker recovery times, and smaller scars. But it's not all rosy. There are challenges to overcome, such as the high cost of robotic systems and the need for specialized training for surgeons. Yet, the potential benefits for patients are driving the rapid innovation and adoption of this technology. From here, the future of robotic surgery only gets more exciting. With advancements in artificial intelligence and machine learning, we could see robots performing surgeries independently or even remotely, guided by surgeons from across the globe. This could revolutionize access to high-quality surgical care, particularly in remote or underserved areas. Can your genes determine the best treatment for you? This intriguing question is at the heart of personalized medicine, a rapidly evolving field that takes into account unique genetic makeup to tailor treatments for each individual. Let's delve into this fascinating world. Personalized medicine, also known as precision medicine, is not a new concept, but it's been gaining significant momentum in recent years. It is the customization of healthcare, with medical decisions, treatments, and practices being tailored to the individual patient. Instead of a one-size-fits-all approach, doctors can stratify patients into different groups, with medical decisions, practices, interventions, and/or products being tailored to the individual patient based on their predicted response or risk of disease. Now let's talk about gene therapy. This is a technique that uses genes to treat or prevent disease. In the future, this technique may allow doctors to treat a disorder by inserting a gene into a patient's cells instead of using drugs or surgery. Gene therapy holds promise for treating a wide range of diseases, such as cancer, cystic fibrosis, heart disease, diabetes, hemophilia, and AIDS. Let's take a real-world example to illustrate these concepts. A little girl named Emily Whitehead was diagnosed with acute lymphoblastic leukemia. After 2 relapses following chemotherapy, her doctors turned to a then experimental option: CAR T-cell therapy, a form of gene therapy. They reprogrammed her immune cells to recognize and attack her cancer. Today, Emily is in remission, a testament to the potential of personalized medicine and gene therapy. However, it's important to remember that these are complex technologies. They require extensive research and rigorous clinical trials to ensure safety and efficacy. Despite the challenges, the potential benefits are enormous. In conclusion, the era of one-size-fits-all medicine is gradually fading. Personalized medicine and gene therapy are no longer concepts of science fiction, but a reality that is transforming lives today. They are paving the way towards a future of individualized treatments, providing hope for countless patients around the world. Personalized medicine and gene therapy are paving the way towards a future of individualized treatments. With technology advancing at such a rapid pace, what does the future hold for medical technology? As we have seen, the potential is immense. Telemedicine is bringing healthcare to remote areas, breaking down geographical barriers. Artificial intelligence is not only aiding in diagnostics but also predicting health risks, making preventive care more effective than ever. The precision of robotics in surgery is reducing recovery times and enhancing patient comfort. And let's not forget the promise of personalized medicine and gene therapy, tailoring treatments to the individual for maximum efficacy. But with these advancements come challenges. Ethical considerations, data security, and ensuring equal access to these technologies are hurdles we must overcome. The road ahead may be steep, but the rewards are worth it. As we continue to harness the power of technology, we are not just changing the face of medicine, we are changing lives. The future of medicine is bright, and technology is the torch leading the way.